All good? Well, it's wonderful to be here on the Gold Coast at the Gold Coast University Hospital with Meaghan Scanlon, and we are celebrating 176 new nurses and midwives starting here at both the Gold Coast and Robina hospitals. One of many nurses and midwives that will be starting up over coming weeks across the state, and we know that we have increased our number of nursing and midwife graduates by 50% over the next 2 years to really boost our health workforce that we know is so needed across the community. So I want to acknowledge the many years of training that these nurses and midwives have been through to get them to this point. I wish them all the best in their new roles at the Gold Coast here. We know they're invaluable. We know the work that our nurses and midwives do is absolutely crucial. And it doesn't matter where they're working in our hospitals, of course our nurse practitioners as well and our nurse navigators, they all play a really important role, and the health system cannot operate without them. So I welcome them, and I hope that they stay in the public health system for a very long time because we are absolutely in need of them, and we are so proud that they've chosen us as their employer. I'm also announcing here on the Gold Coast the tenders have closed and we have announced tenders for $88.5 million of investment here on the Gold Coast for our capital build. This is part of our health and hospitals plan that we announced in last year's budget, and that goes to the subacute expansion of beds at the Gold Coast University Hospital, an additional 70 beds, and also 20 additional ED bays, so emergency department bays at the Robina Hospital. So I know these 90 extra spaces will certainly come in handy as far as the challenges and pressures that our hospitals are seeing. And those two projects are due for completion at the end of this year and also mid next year. So I'm really thrilled that we can announce those projects. The successful tenderers for the Gold Coast University Hospital, which is $72 million, is Broad Construction, and Elder Construction has been successful in the tender for the Robina Hospital ED expansion, which is another $16.5 million. So we're thrilled that those projects are going to get underway very shortly. Of course, they are part of a much bigger investment pipeline right across this state, both with our 3 new hospitals, 11 expansions, and the additional rural and remote health facilities that we are building every single year over the next 7 years. I'll hand over now Meaghan to say a few words. Thanks.
Thank you, and wonderful to be at Gold Coast University Hospital today. Of course, if you're a Gold Coaster who is sick or injured, you want world-class health care, and that is what our incredible health services provide. Since coming to government, we have increased the operating budget of Gold Coast Health by 83%, and that's seen around 2,400 additional health staff here on the Gold Coast. And today we're welcoming some of those new health staff that will be hitting the ground here over the next few weeks. We have incredible young talent here on the Gold Coast. We have some universities who are really providing those exceptional, particularly young people, but also people who may have changed their career, who have that qualification and are able to get a job in their home. And in fact, I was just talking to Brianna from my office, and she went to school with one of the graduates here in Southport, so it's wonderful to see so many Gold Coasters actually getting employment here at the Gold Coast University Hospital. It is one of the biggest employers, in fact the biggest employer I think on the Gold Coast. But as the Health Minister just mentioned as well, we are investing significantly as well in the infrastructure that we need for a growing population like the Gold Coast, as well as the 2 projects we're announcing today. Earlier in the year I announced the contractor for the 40-bed mental health rehabilitation unit that will also be built at the Gold Coast University Hospital. We've also committed to building a new Coomera hospital. We're building a new satellite hospital in Tugun. That is on top of the expansion that we'll also see at Robina over the next couple of years, and also adds to some of the projects we've already finished. We finished only recently the crisis mental health stabilisation unit in Robina, and we also completed an expansion of the emergency department here. So there's an enormous amount of investment that's going into the Gold Coast to make sure that our community has the health services they need. And over the coming few years, with this capital investment, we will see 648 additional beds across the Gold Coast, which is wonderful. And as well, well, we'll be seeing, of course, thousands of additional health staff employed across Queensland, particularly here on the Gold Coast, where we know that population growth is increasing the demand. So wonderful to be here, and I think if we were at every milestone, the Health Minister would be here every week. So it's wonderful to be able to share in so many wonderful moments. So thank you.
Questions?
Obviously, ramping lack of beds has been in the media for quite some time now. What is on offer at the moment? Is that just a drop in the water? Is it going to be enough? Is it coming too little, too late for patients, that have already been waiting hours to get into our hospitals?
Well, as Meaghan just said, this is not the first investment in the Gold Coast. We have been investing in the Gold Coast Hospital and Health Service since we came into government in 2015. So this is one of many, many projects, and there's been many beds already brought online. But the challenge is this, and anyone who says, well, the beds are the only fix, don't understand the complexity around pressures on the health system. The demand is outstripping what we need to do within our hospitals, and even the 2,500 extra hospital beds we'll be bringing on over the next 6 years with all of this investment. That alone will not fix all of the problems, because the challenge is that we have GPs who are stopping bulk billing, so people will stop going to GPs as often, and those people, if they do not look after their health care, will end up with complex and chronic illnesses in our EDs and in our hospital beds. We have people who are in our hospital beds today who should be in aged care or should be getting supported care at home, or people with disabilities who do not need medical care. They have had their medical care, but now they are residing. They are residing in our hospital beds because they can't get those placements or support in the community. That is a conversation we're having with the Commonwealth. On average, it's between 500 and 600 hospital beds across the state being taken up in those situations. We have people taking up less private health insurance, the lowest we have seen in this state. And when they do have private health insurance, they're still turning to our public health system to access healthcare services. We have an ageing population and we have a boom in migration in this state. Everyone wants to come and live in Queensland. And consequently, all of these things combined is causing pressure. We had a decade freeze on Medicare. We haven't had a proper revision around the health reform funding, which is a conversation we're having with the Commonwealth right now. Every state and territory in the country is facing these challenges, and we are all working together on those solutions. But having said that, things we can control, such as major investment in capital, biggest we've seen in our history, we are doing. Major investment in staff, 9,475 extra doctors, nurses, midwives, allied health professionals being employed in this parliamentary term by the Palaszczuk government. So we are doing everything we can, but there is a lot of other factors outside of our control that we are working with stakeholders to try to address.
When will the first of these new beds actually be available?
So the 20 bays that we just talked about for the ED in Robina, that will be late this year. So within 12 months, we'll see that completed. For the 70 beds expansion subacute, that'll be mid next year. And of course, we will see a lot more when we have the new hospital being built and other expansions that we've talked about.
Miss, where are the doctor shortages across the state?
Where are they?
Yeah.
I think if I talk to my board chairs and my chief executives, every single one of them would say we need more doctors. So there isn't, there isn't a situation where we have an oversupply in one area and undersupply elsewhere. We have a shortage, particularly not in every profession. We have shortages in relation to specialties in different places across the state. We know that we need more obstetricians and gynaecologists. I know we need more ophthalmologists. I know we need more anaesthetists. We need more rural generalists. We need more GPs. The number of doctors graduating, you go talk to intern doctors right now and ask them how many are looking at going into general practice. It's a very, very small number. The prediction is over the next few years we'll only have about 15% going in, and we've got more than that retiring. So there isn't one place where we can say we don't need any doctors or any specialists.
Could you say which areas are most affected?
Oh, look, again, I wouldn't try to guess that off the top of my head. We know right now I can say to you, I need obstetricians and gynecologists in Gladstone. I need additional in Rockhampton. I need more registrars and specialists in Mackay. So I can tell you that. If I go to Townsville, they'll talk to me about ophthalmologists. So everywhere I go, they'll mention where they have their shortages.
Is there any specialists that are most in need? Is there any
Look, right now, certainly we are prioritising the obstetrics area, because we know the challenges that we're facing across the country in relation to that area, and particularly where we have to divert people away from the hospital they would normally be delivering their babies. So that is a crucial issue for us right now, but I want to make it clear in prioritising that, we in no way are stepping back from all of the recruitment we're doing in the other areas as well.
In terms of, I guess, for doctors working in regional and rural areas, it can be hard to find accommodation.
Yes.
What's on offer from Queensland Health?
Yeah, so we're building more accommodation, we're building more student accommodation. So part of our capital investment in last year's budget was looking at, okay, it's one thing to attract doctors and try to retain them and nurses into these regions, but some of them tell us, even if, it doesn't matter how much money you've got, there isn't the stock. So we are looking at where we can build additional accommodation and working, these are conversations we're having with the Minister for Housing, and we're working with, Public Works as well about what we can do in this space. So I'm working with Minister De Brenny, I'm working with Minister Enoch. These are challenges for whether you're trying to attract teachers, whether you're trying to attract doctors, police, all of those things, accommodation's an issue.
Are there any incentives in place?
So we have a range of incentives in place to attract and retain health professionals in the regions, and obviously the more remote, the more the incentives are there. There are also things we're talking to the Commonwealth about. When I was in Cooktown, the nurse there said to me, look, you give us free flights every year to go back and visit family. The problem is, come tax time, we lose half of that with FBT. So we're talking to the Commonwealth about what they can use as levers as well around taxes and those other issues where we might be able to improve on those incentives. It is a challenge because right now every state and territory are competing against each other, and we're competing nationally. I said the other day when I was standing up with the Premier about our intern doctors, 96,000 vacancies in the National Health System in the UK right now. So this is a global problem.
It's a pretty long road to compare us to the UK though, do you think? The health systems there is arguably in worse nick than ours?
Well, I would love for more people to compare us to other nations, because what they would see is that we have a healthcare system in Australia and in Queensland that we should be extremely proud of. We do need to look overseas to see what is happening, to reflect on the fact that we have free healthcare here, where someone can come in and get their hip replaced, their knee replaced, cataract surgery, all the things that they need. Yes, there is a waiting list for that because that's what comes with a free public health system, but it's one that we should be very proud of. But we don't shy away from the fact that we have challenges, and we need to make sure that our free public health system in this country is sustainable for the long term, and that's why we're having these conversations with the Commonwealth as well.
What's the latest on the Coomera Hospital? How work's progressing out there?
So it is all of the work we're doing. So I announced when I stood up with the Premier at the start of this week that we are going out to tender shortly on all those other big projects. So that's where we're at the moment. So the 3 new hospitals, the tenders are going out very shortly, and our timeframes are still as we announced in our Health and Hospitals plan.
If I can ask about the DNA labs, Kathy Allen and Justin Howard still suspended?
Yes, they are. Yes, so there's a show cause process that is still ongoing in relation. I can't go into the details, but in relation to those, I understand that they sought extensions for a range of reasons to respond to the show cause. So they still are under their show cause. They are not working in any of our hospitals currently.
Are they suspended with pay?
So one of them's suspended with pay, the other one is suspended without pay.
Okay, can you tell us which one?
Kathy Allen's suspended without pay.
And just one more, what do you make of Peter Coldrake's wife being among a group of protesters who appeared in court over the disruption of Parliament last year?
I'm not going to comment on any individual. People have the right to protest. The only thing I ask is they do it respectfully and peaceful protests. But it's not for me to comment on any individual, who might appear before court on anything.
Just a quick question about Mackay-based hospital.
Mm-hmm.
I understand there had been some reporting that the works there have been fast-tracked, but that's not the case. Can you talk me through where we're at there, though? Is there a short list of contractors?
So where we are with Mackay is that it's due for completion in 2026, and that's exactly what we intend to deliver.
Just a quick one as well on GP payroll tax.
Mm-hmm.
What impact will that have on bulk billing? And at the end of the day, do you think that will impact the most vulnerable in that society?
So the Treasurer spoke to this yesterday and made it very clear that there is ongoing discussions with the peak bodies that represent doctors in looking at solutions to this issue right now. Thanks, everyone.
Thank you so much.